Hi, my name's Sarah Jones. I'm AWP's Director of Nursing and Quality, and I want to say an absolutely massive thank you today to all of our learning disability nurses. So our learning disability nurses are a small part of our nursing population in numbers, so around about 75 of you out there, but my goodness, are you big on what you do and what you deliver. Learning disability nurses are absolutely amazing and essential to the work that we do in AWP. Learning disability nurses challenge misconceptions about people with learning disability and indeed with autism as well. They are the most amazing advocates for people with learning disability and autism, constantly challenging the rest of the health service and wider to make sure that people with learning disability and autism get the right care that they need. You guys are absolutely fantastic, and I know that in AWP you work across our community services, you've worked in our inpatient services, you're being a massive part of developing our new service for our inpatient service over in Bristol, but also developing constantly our community offer to make sure that our population with learning disability and autism are well provided for. You guys are amazing, and a massive thank you to you all this Learning Disability Nurses Day from me and from the rest of the organisation. Thank you so much.
Hello to all of our learning disability nurses in AWP today. It is National Learning Disability Nursing Day today, and I just, as I said, want to say a really big thank you to each and every one of you. It's a day for us to celebrate as learning disability nurses and to reflect on our achievements as individuals and also as a collective of learning disability nurses in AWP and across the country, because our contribution across, it does spread all the good work we're doing, and it makes our experience for people with learning disabilities much more improved. So we all contribute to making the lives and outcomes for people with learning disabilities and autism equitable, and we do this by removing the barriers that we know are often encountered when our individuals access healthcare and social community opportunities. I'm proud to say that I'm proud to be a learning disability nurse, and I've learnt so much over my whole career from the people I've supported and their families and carers.
Learning disability nurses are very good. They help you with all your learning disability needs, and some learning disabilities are hidden and some are not. I'd like to say thank you to all the learning disability nurses for all their help. Yes.
So let's hear what our learning disability nurses have to say.
What I've really enjoyed about the role is the amount of variety that the qualification brings, and the amount of and the opportunity to work with your sort of clients kind of holistically, and also the variety of settings and the sort of variety of different conditions that you might, from a professional point of view, that you might encounter in our client group. So the chance to work with different services all over whichever area of the country you live in. Acute health services, mental health services, substance use services, forensic services. There's just loads and loads of opportunity to work in different settings with different people. So I found that to be a really sort of fulfilling and interesting part of my role.
I've worked as a learning disability nurse in many different roles for over 25 years. I've had the privilege of getting to know, support, learn from and work with some amazing people. I still feel as passionate about being a learning disability nurse as I did when I first started my training, and I continue to feel proud to call myself a learning disability nurse.
What I really enjoy is no day in learning disability nursing is ever the same. There's always something new. You can never tell what your day is going to be like. We have to, as learning disability nurses, think outside the box and be really creative, especially with our paperwork, such as our easy read formats. And I love working with the client group because of the wide range of presentations that we see, and when we make adjustments for this client group, we just see how much they thrive going forward, and it's really nice to see.
So I've been a learning disability nurse for around 6 years now, and it just is something that I've always been a passion of mine to support people with learning disabilities or additional needs. So I enjoy the most about my role that every day is different. No 2 days are the same. I come across completely different individuals every day with a wide range of needs, and everyone makes me laugh every day. My service users absolutely kills me because they're such happy, bubbly people, and actually I want to continue to support them. So yeah, every day is different. Nothing's the same in LD nursing.
The thing I enjoy most about being an LD nurse, more than anything, is probably the service users. They're all so interesting, and they just have their own individual personalities, which are just amazing. And I think people don't really realize that sometimes, especially when you're working in a care environment. But for me, it's the people.
I enjoy the fact that the days are varied and that no one day is the same. In the learning disability service, I love the fact that you need to be creative in your approaches to people with learning disabilities. So over the years, resources have been fairly limited for people, so we've had to learn how to be creative in order to bridge that gap.
I feel really passionately that people with learning disabilities deserve the best possible care and deserve to have a fulfilled, happy life, and I want to be part of that and help to advocate for their needs. I think that some of the service users I've worked with are the most inspiring people that I've ever had the pleasure of meeting. They are constantly pushing me to learn, develop, reflect on my own practice, and always remind me that they need to be at the centre of their care. It also means that I get to work with a really wide range of professionals as well, all who have a different viewpoint. I think in learning disability nursing, there isn't always a hard and fast right or wrong. I think it's about being creative and innovative and working with the resources you've got to fit around a person to truly get their needs met in a way that they want. And fitting with their needs.
Very appealing to a lot of people, especially myself, because it really fulfills your caring desires, your aspirations, that you get to support those who are the most vulnerable within society to achieve their fullest potential, and you get to advocate for them and make sure that other healthcare services provide the best possible quality care.
So just to say, whatever you're doing today, have a great day and take some time to appreciate yourself as a learning disability nurse. And again, thank you everyone.
Thank you so much.